Okay, this case diagnosis is lichen planus. Lichen planus for the clinic, that is multiple lesion, usually in the ribs or maybe in the extended surface of the extremity. Then lichen planus is the classic changes in the lichenoid interface dermatitis chapter. So I think some people are always kind of confused about lichenoid changes. When they see tons of lymphocytes in the dermis, they will say this is lichenoid changes. But truly, lichenoid interface changes, that means we not only find tons of lymphocytes in the dermis, but another thing we need to see, you can see in this DEJ junction, you just could not draw a really clear line between the epidermis and the dermis. When you see these changes, this is true lichenoid interface changes. If you can see really clear between the lymphocyte and the epidermis, that is not true lichenoid changes. So like this case, lichen planus, this is true lichenoid interface changes because you just could not draw a clear line between the epidermis and the dermis. Of course, in low power, we can see this really dark area that should be lymphocytes. And then let's zoom in to see some other feature for lichen planus. So one thing you need to bear in mind, the BLK, that is the benign lichenoid keratosis, and lichen planus, usually in the microscope, they are identical. You just could not tell them apart usually. But one thing you can tell them apart, that is lichen planus. You can think like a strict parents. They have really strict diagnosis criteria. The first one is you could not see parakeratosis for a lichen planus. You can just see this wave basket of parakeratosis or maybe hyperkeratosis. You could not see any nuclei in the stratum corneum. If you see any parakeratosis nucleus in the stratum corneum, you could not make the diagnosis of a lichen planus. And then you can see this thicken of the granular cell layer. I think this one is not really good. I have another good example to show you this feature. That is the pyramid shape of hypergranulosis. That means this purplish cell just forming kind of like a triangle shape, something like this in the lichen planus, but this one is not really good. Then let's zoom in to see other feature. These cells lose the nucleus. Actually, these are the keratinocytes, but this cell we call the keratinocytes is dying. Another term is this keratotic keratinocytes. If you want a fancy term, that is Shiva body in the epidermis. If you find something like the same thing happen in the dermis, maybe this cell or maybe other cell also lose their nucleus, that is the colloid body for this lesion. Then you can see these true lichenoid changes. So the lymphocyte just attack the DEJ junction to just make kind of blurry of this DEJ. So again, make this diagnosis. You also could not find any single eosinophil in the dermis. If you see eosinophil in the dermis, usually told you away from the lichen planus. I think this is just red blood cell, not eosinophil. So then you can see this dying keratinocytes. This is colloid body, this is VAR body, tons of them. So and then you can make the diagnosis of lichen planus. So just quick pickup. Low power, see this lichenoid intervening changes, really blurry DEJ junction. Then just wave basket of keratosis, and then hypergranulosis. Then you can see dying keratinocytes in the epidermis, and then no eosinophil in the dermis. Then you can make the diagnosis of a lichen planus. Here I want to show you another Lichen planus case. So low power, we also know that this is true lichenoid interface changes, because here you cannot see a really clear DEJ junction here with this band really heavy infiltrated lymphocytes, and then hyperkeratosis here. This one just show you really good this pyramid triangle shape hyperkeratosis here. And then because the lymphocyte try to attack the DEJ junction, so sometimes you will see this empty space, kind of DEJ junction of 4 parts, could not kind of confuse about the split disorder, just like pemphigoid or maybe pemphigus or other blister lesion, because this normally the lymphocyte will attack the DEJ junction, so they will create this space. Oh, and then one thing I forgot to mention, true lichenoid, this lichen planus, you see this jigsaw. That means this DEJ function, DEJ, you just see this jigsaw changes because the lymphocyte just like attack the DEJ. Because usually our melanin just stay in this basal cell layer. So if the lymphocyte try to attack this DEJ junction, this melanin pigment will drop out. That means this pigment will go to the dermis, something like this. Because of the lymphocyte attack the melanocytes, maybe the keratinocytes, so the pigment will just go down. So this one is another one for lichen planus. Then I want to show you benign lichenoid keratosis. As I mentioned, it could be identical to the lichen planus, but for the clinic, the dermatology will tell you just a single lesion, not multiple lesion. Then you will think about just benign lichenoid keratosis, not lichen planus. But actually, the changes is really similar. We also can see these really lichenoid changes. You can see this DEJ is kind of blurry. This one is really good. You just could not tell the epidermis and the dermis. You can see these jigsaw changes of the DEJ because the lymphocyte just attack the DEJ junction. Then we can see this pyramid hypergranulosis, something like this. And then a lot of dying keratinocytes. You can see it everywhere. Oh, and then for the text purpose, if you do immunofluorescence for lichen planus, you will have some, I think, IgG and C3 deposition in these dying keratinocytes in the dermis. So that's a characteristic feature for the immunofluorescence for the lichen planus. So you can see benign lichenoid keratosis just look like identical to the lichen planus. But sometimes you may find eosinophil or maybe keratosis to make you more thinking about benign lichenoid keratosis. But this one we just could not see. Another case for BLK, benign lichenoid keratosis. We also can see lichenoid band here. And then the DEJ junction, because attacked by the lymphocytes, so they kind of fall apart. And then we can see some pigment drop out here. And then pyramid hypergranulosis. And then with a lot of dying keratinocytes. So this one is another case of BLK. And then for the differential diagnosis, I would like to put this one because I think for the text purpose, this one is really easy to make diagnosis. This one, the diagnosis is lichen nitidus. Actually, you can think about just like this is a lichen planus, but really focal, Lichen planus. We have this color red, the epidermis just hugging this kind of ball-shaped lymphocytic infiltrate like a Lichen planus or maybe BLKs. And then when you zoom in, you may also see histiocytes forming kind of granuloma with the lymphocyte. You can see clearly this is histiocytes mixed with the lymphocytes. But we can see clear this lichenoid interface changes. So this one is lichen nitidus. I think for test it's really fair to give you this because this one, really easy to make the diagnosis. You can see also find some parakeratosis here. So when you see parakeratosis, just do not make the diagnosis of a lichen planus. It should be something else. So hopefully you can recognize this lichen nitidus, just like small focal area of lichen planus or BLK.